Awesome. Thank you, Becca. All right, I'm going to give it one more minute and then we're going to jump in. Right. So in the interest of time, we're going to go ahead and get started. Wanted to say hello to everyone and thanks for joining this exciting learning session. My name is Savannah, for anyone on the line who doesn't know me. I'm a manager at Global Health Visions. I'm really excited today to introduce you to our three speakers. We have Skye Wheeler, who's the Senior Researcher, Women's Rights Division at Human Rights Watch. I actually met Skye recently through a project with the International Confederation of Midwives, as they're looking at adding a new priority to their strategic plan that focuses on midwifery preparedness in the face of humanitarian crises and climate change. We also have Rafia Rauf, who's the project director for Safe Forum for Motherhood in Pakistan and a national coordinator for the White Ribbon Alliance. GHV has worked with Rafia through various Gates Foundation projects with the Maternal and Newborn Child Health PAC team and through our work with the White Ribbon Alliance. And then we have Zainab Jah, who goes by Z. She's a senior program associate at a Reproductive Health Impact, who was formerly the National Birth Equity Collaborative, and had the privilege, along with Susanna, to work closely with Z a few years back on a maternal health donor landscaping project that we did for the Global Force for Healing. So just want to flag, I'm going to turn the presentation over to our three experts here. We'll save about 10 minutes at the end for question and answer. So over to you, Skye.
Thank you so much. So yeah, my name is Skye. I'm the emergencies researcher at the Women's Rights Division at Human Rights Watch. The last 4 years, we've been working to advocate for more attention on how climate impacts are directly and indirectly harming maternal and newborn health outcomes. I consider myself still new to the climate space and definitely new to the maternal health space. So events like this is also definitely an opportunity for me to learn. So I hope to hear from you. Hello, yes, I was in South Sudan. Oh, it seems like a long time ago. So I want to use my time here to share a few key resources. Mostly these are epidemiological studies with you about climate impacts on maternal health. We've been using these studies and interviews with very impacted communities to advocate to the maternal and newborn health community. So people like many of you, that we need to see you engage much more robustly with the climate crisis. We've also been advocating to the climate justice movement and to, the folks trying to cut carbon and protect forests, that they cannot afford to ignore maternal and newborn health either. So a lot of the work that we do is trying to kind of break down this silo. And as I hope to express a little bit, I really feel like care workers within the maternal and newborn health world have a lot to give in terms of designing or visioning a more sustainable and healthy world. I also want to share a few advocacy points, and really there's only one that I really want you to communicate, and that is there is a growing tendency, and it's in a way it's very positive for people to start thinking about building climate resilience and adaptation for pregnant people. So how do we protect pregnancy health from heat, from wildfire, from all these different impacts? And our advocacy position, our hope is that the maternal and newborn health community will also, maybe even equally, also engage in mitigation, in advocacy to cut carbon emissions and to protect forests and other carbon sinks, that both need to happen. And your voices are missing, or in my narrow experiences, are missing from the climate movement. Okay, next slide. Okay, so that's that key message, which is just, you know, building resilience is key, but so is disrupting power. Okay, so I mentioned about sharing resources, and here is a really key resource. The World Authority on Climate Science, the IPCC, is constantly building an ever-increasing body of epidemiology and other climate and other kinds of science on how the climate crisis is hurting public health and eroding gains already made on every front. And they are increasingly making the argument that climate harms are growing unjust inequities in who gets to have a healthy pregnancy and who gets to have a healthy newborn. So these inequities are obviously between countries, and the climate justice movement is all about how these inequities are already far too great between high carbon emitting industrialized countries and low carbon poor countries. But I think it is really important that we also understand that even within high carbon countries, we're seeing marginalized communities hurt much more by the climate crisis than wealthier communities. So the justice issues cut across both the high and middle income divide. Okay, so what are the particular impacts that the IPCC report talks about? So I'll let you kind of cast your eyes through some of the highlights here. But I wanted to talk about what a man, Z, who's going to be presenting later, and I met in Freetown, a gentleman called Arifa Kumara. He runs a totally unfunded climate and women's rights organization in Sierra Leone called Her Future Foundation. And he gave us a really rich understanding of the different ways pregnant women and girls where he lives are impacted. So working on land they cannot own because they are women. That land is producing less and less food, including dark green leafy vegetables that they traditionally eat a lot of when they're pregnant in order for nutrition. The lake next door that they use for watering crops is drying up. It's also has toxicity issues because of gold mining. That's historically an environmental injustice issue from the area. Any cash they do make from cash crops is controlled by men in their society. And all of this happening within a context where flooding in other parts of the country is also driving inflation connected to loss of agricultural productivity. Okay, so this is just a really classic example of how multiple harms are happening at the same time over different time lengths. There are acute harms, there are long-term harms. So this is the other kind of obvious issue, but we often miss it when people are first thinking about how they're going to engage with this, is that picking just one issue kind of lends itself to kind of whack-a-mole, right? Because there's just so many different kinds of ways that the climate crisis is harming people. We did also ask midwives in the main government-run referral hospital in Freetown whether they were seeing heat impacts. And this is something that is really important for both Z and I, who was with me, is to acknowledge that for these interviewees, extreme heat is way down on the list of priorities. They don't have drugs, the ambulances don't work, the pregnant people they serve turn up to their hospital already having hemorrhaged large amounts of blood. They have frightening rates of maternal mortality at this hospital. But even in a context like this, you can see some of the impacts of extreme heat having a very direct impact on their ability to provide services. So we followed, not just in the case of Sierra Leone, but in other parts of our research, we've always, really, it's been very important to us that we don't only say the maternal and newborn health world needs to do more about the climate crisis. It's the other way round is also true, that the climate crisis is a major reason why we need a stronger maternal health systems, right? It's a very important reason, given the increasing instability. This is a powerful argument for building better maternal health systems in ways that you are all already trying to do in the sector. But we're also hearing from interviewees about corruption, about how money doesn't reach communities. So there's also frustration in the model that's currently in place to try and improve maternal health. And I guess one of the things that is kind of emerging in the climate movement is, questions about decolonization, questions about new ways of thinking about improving systems and working with big international problems together in solidarity. So those are also important questions. And, if there is going to be loss and damage funding, which is the great hope for the climate justice movement, is that at some point, high carbon industrialized countries are going to pay reparative funds to hard hit countries. What is it going to look like? How is that money going to get to the workers that need it most? So as well as continuing to build strong maternal health systems, like other academics and others who have been working at the maternal health and climate intersection, we do also hope to see new ideas about protecting pregnant people from extreme heat, new ideas about, low cost and easily scalable ways that we can provide improvements in terms of emergency preparedness, for example. But where the rubber meets the roads in terms of interventions is this question. So in Florida, for example, when we're looking at how a low-income family can be better protected from extreme heat, hurricanes, in some parts of Florida, even wildfire smoke, it's not a clinical question. It's about multi-sectoral. So who can also connect that pregnant person to electricity subsidies? Who can also help that person with emergency preparedness and that separate body of authorities? So who are the workers who really can perform this kind of multi-sectoral role, where they are speaking to many different kinds of problems, not just health problems? So in Florida, we've begun to explore how maybe doulas are exceptionally well placed to be able to provide this kind of support. And Z will be speaking a little bit more about that in her presentation. So for the next few slides, I thought I would just dive into extreme heat exposure and maternal and newborn health outcomes. I won't go into a lot of detail on this slide because of time, but heat is more and more emerging as a human rights priority. So whether you're looking at heat at work, like who is most exposed to extreme temperatures at work, that's low income, poorly paid work that is poorly regulated by the authorities. When you're looking at housing, who lives in quality housing that can provide some protection from the heat, and who lives as a someone from the mayor's team in Freetown described to us there, with nothing between them and their baby and a heat wave, but a boiling hot tin roof, is really, these are really like human rights questions as well as health questions. So pregnancy is a vulnerability to heat is increasingly known, but it's often forgotten. For example, we reviewed 105 official heat safety web pages, climate action plans, heat advisories from the 18 largest cities. And out of the 100, over 100, we found only 2 documents that mention pregnant people as at risk from extreme heat. And in those same group of documents, we found 37 references to the dangers of heat to pets. So, that just really, things are improving, but we're still not really making sure that pregnancy health is included in how we think about things like extreme heat. Okay, so we have lots of studies about how extreme heat is associated with premature birth and stillbirth, especially. We have studies from Europe, China, Australia, but this slide contains some links for you for US studies, because most of them are from here, but also because they tell us something very important. As you can see in the JAMA review study, but also in a couple of new studies, just here for 2 as examples, one from Minnesota, one from Texas, whenever you disaggregate the impact by race, you see that there is a far significantly bigger effect of heat on premature birth and stillbirth in Black pregnant people than in white pregnant people. And this is such an important finding for us coming at this from the human rights perspective, because what we're seeing is that the climate crisis is not only a health problem, it's a justice problem, it's a reproductive justice problem too. Okay, so like I said, there's a pretty good amount of studies now from higher income countries, not enough research at all on extreme heat and these impacts from low and middle income countries. But they fairly recently, a study on preterm birth and stillbirth, it was a review study, and they found that across 14 countries where they looked at this data, they found the same finding in low and middle income countries too. And I've also provided a link here, a review study just on stillbirth, which I think I understand is increasingly an area of concern for the maternal and newborn health community, is that stillbirth needs more attention. So, that's a useful study for you to have in your back pocket too. And it also makes as I've highlighted here, the authors make the very good point that there are still no evidence-based interventions. We're well behind in terms of programming on this. This is a really useful study I also wanted you to have. So instead of looking at an impact like heat or hurricanes, wildfire, it looks at preterm birth as the outcome, and looks at the myriad of different climate reasons why the climate crisis is adding to preterm birth. So it's a really useful study, and as the authors said, we should really be using preterm birth as an indicator of how bad the climate crisis is, as one way of understanding whether we're beginning to grapple with a climate crisis, what are the appropriate interventions for us as a society to put in place. But that's, as the author also mentions, that's not happening yet. For example, if you look at a lot of the national adaptation plans, those are plans that every country is supposed to write every year under the Paris Agreement. They are often missing pregnancy health. And even when they do include pregnant people as like one of a vulnerable group, they don't talk about how it's not pregnant people, it's some pregnant people, right? Like, so if you're high income and you live in AC and you go to work in a AC, and then you go to the bus that has air conditioning, you're not going to be impacted by heat at all. It's an inconvenience, and yet for someone else, it's a completely miserable and dangerous problem. It seems very obvious, but it's actually missing in the policy analysis. Here's a useful study for you. I used to ask very little medical and biological science on heat and pregnancy. There's lots about athletes and soldiers. And I used to ask people, academics, why, and they said, well, it's because we can't put pregnant people in a heat, you know, in like a lab. We can't like put them in a heat chamber and turn up the temperature, because, you know, that would be unethical. But this researcher went to the Gambia, and she took the temperature and worked with pregnant people who were working as subsistence farmers in high temperatures. And she found, I believe in about 30% of the cases, when the pregnant person was at a high temperature after doing heavy work in the sun, she found evidence of fetal strain, which I think is really interesting and important. There's also an accompanying study here, which is also where the same author very helpfully looked at how extreme heat was connected also to gender and poverty. And there's a study about the biological mechanisms too. And I'll just finish here because I want to leave time for Z to talk. But just to say that there's also been an increasing body of studies that are showing exposure to high temperatures linked to maternal health problems too, including hypertension, gestational diabetes, and pregnancy complications. And just to say again, when these studies have been done in the US and when they've been disaggregated by race, we again see bigger effects for Black pregnant people. Again, taking us back to the importance of viewing this through a reproductive justice lens. So I think I have some more, but I think I'll stop there to let Z have a chance to present on her work. But look forward to carrying on the conversation. Thank you.
Thanks, Skye. All right, let me go ahead and share my screen. All right, I do have to apologize. I do have a conflicting meeting, but I'll leave when I finish my presentation. And thank you, Skye, for setting up the science behind it. And I can provide an overview of the work that we've been doing. So my name is Zainab, or Z, pronoun she, hers. And I'm a senior research analyst at Reproductive Health Impact. And I'll be talking a bit about doulas at climate change frontline workers. So a little bit of background around our rebranding. So as mentioned before, we were previously National Birth Equity Collaborative, and we've now rebranded to Reproductive Health Impact, the Collaborative for Equity and Justice, to really capture the spectrum of work that we were doing before. We were really focused on the Black maternal health crisis, and we still are, just with a bigger spectrum across the reproductive health outcomes. So our mission is, in collaboration with communities, we'll challenge systemic inequities to achieve reproductive equity and justice. And we do this through research and evaluation, policy and advocacy, capacity building, and power shifting. And we really center voices and lived experiences, scholarship, and activism of Black communities with the vision of creating a world where Black communities can achieve our full potential for reproductive health, well-being, safety, and joy. A lot of the same values that we had as NBEC. And just to ground us in the reproductive justice framework that Skye has mentioned that we utilize in all of our work, it was coined in 1994, and Sister Song defines it as the human right to maintain bodily autonomy, to have and not have children, and to parent children in safe and sustainable communities. And I think that's the part that we really hold on to in recognizing how conditions of the environment are greatly impacting reproductive health outcomes and maternal health outcomes. And reproductive justice utilizes an intersectional approach where we're thinking about housing, food security, water contamination. And so all of that is really important, and it's seeing the full picture of what's at stake. And we also think about the power dynamics that are at play policy-wise and systemic-wise. Environmental racism greatly contributes to the injustices that we see. And we see how redlining leads to increased exposure to air pollution, toxic waste, water contamination, and how all of those are impacting reproductive health outcomes and maternal health outcomes, and why it's very crucial to utilize this lens when doing this work. So just to give a little bit of background on how we got here in creating the survey, as Skye mentioned, we've worked a lot together, and we worked with Esther McCant through Metro Mommy Agency, which is a doula org in Miami, Florida. And we came together along with Tony Oberly, who was our birth equity scholar at the time, who was also a doula, to create a training to doulas to basically see exactly how environmental injustices and climate change are impacting pregnant people and what kind of outcomes we're seeing, such as stillbirth, low birth weight, et cetera. And Tony did an amazing job of creating a mock workflow that basically showed the support that a doula would give throughout the duration of a person's pregnancy and the ways in which we can include recommendations to stay hydrated or recommendations for emergency preparedness in the case someone was preparing or to give birth during hurricane season. There are ways to incorporate the feedback that doulas are already doing or may need support on to protect their clients. And so that's kind of where the conversation started. We also learned from the doulas themselves because, as mentioned, they're already doing the work. They're the frontline workers. They're working with their pregnant communities. And so we really learned from them as well. And then we took a step back and really wanted to get a better understanding of the work that's being done amongst this community and also how folks are feeling about environmental injustices and climate change. So a group of us came together and created the Environmental Justice, Reproductive Justice, and Perinatal Community Health Worker Survey. And here we have pictured one of the questions from the survey asking about whether the person provides guidance or information about pregnancy health harms from extreme heat, hurricanes, flooding, or other extreme weather events to their clients. And the reason that we are wanting to survey doulas about environmental injustice, as you all know, doulas are very much so accessible and present throughout the duration of the person's pregnancy journey, whereas the healthcare system, a pregnant person may interact with doctors in 15-minute intervals where they may not be able to get a full understanding of the social determinants of health or what may be impacting that person. And so we recognize that doulas have a breadth of information and experience, and we really wanted to gauge and understand what are they seeing, what are they doing, are they concerned, and are they interested in learning more? And so the survey team came together, comprised of Human Rights Watch, Metro Mommy Agency, which I detailed before, with Esther McCant in Miami, my organization, Nurturely, which is a perinatal rights and health organization based in Oregon, March of Dimes Mom and Baby Action Network, along with the National Association of Nurse Practitioners in Women's Health. We are all very concerned about the inequities that we see within the maternal health crisis, and we see how climate change is going to exacerbate those inequities. We also recognize that there are deep silos between maternal health and EJ groups, and so we're really hoping to bridge those together through the lens of reproductive justice and human rights as well. And we also recognize that this is an opportunity to reimagine the future and rethink how these systems are in play and how we can best protect pregnant people. So we came together to develop this survey and we shared it amongst our networks, coalitions, and doula contacts that we have. I also have a QR code here. If you want to scan, we can also share the link later on. But this is just a list of resources, including our website, some articles that we've written, and studies as well. Whenever we go to conferences and present or do trainings, we just share this as a resource list, and we wanted to share with you all as well. So I've talked a little bit about this, but what did we want to find out? The main driver was figuring out what work doulas are already doing as frontline workers in protecting their clients from the impacts of climate change, including lead and air pollution as well. We wanted to better understand how, if and how community-based perinatal health workers are concerned or interested in environmental health. And we wanted to see if they were welcome to more resources, solidarity building, and knowledge sharing regarding the intersection of reproductive justice and environmental justice. And we wanted to see if they would take advantage of education and grant opportunities and funding to do this work. I do want to preface that we understand that doulas are carrying so much already and do such amazing work. We're not trying to frame it as doulas need to do this work as well. We are recognizing that they are doing this work, and we also recognize they are underpaid, and we want to be able to get resources to them as much as we can. So who are our respondents? We got 107 respondents from 20 states. As I mentioned before, we shared with our networks and we shared at Health Connects One's Birth and Beyond Summit, where we presented and had little flyers with information about extreme heat and pregnancy on the other side. We had a QR code with the link to our survey. We do recognize that maybe some coalitions are a bit more active than others, so that may skew our demographics. However, we did have representatives from Illinois, California, Nebraska, Ohio, Missouri, and the Midwest region was greatly represented. Most of the respondents were doulas, but we also had some respondents from midwives, lactation consultants, and community health workers. And there's a large range of experience from 1 to 25 years, with the average being 5 to 10 years. Doulas reported seeing 5 to 20 clients a year on average, and 101 out of 107 respondents said that they intentionally work with marginalized communities, with Black communities being the largest group that folks worked with. And many of the demographics qualify for Medicaid as well. We did have a small number of folks that engage with LGBTQIA plus communities and with young mothers as well, but not a large amount. And as I mentioned before, regarding doulas, they are not compensated well, and we recognize that, and that's something that came up largely. About half said they were not happy with the payment, and majority said they could not make a living wage based off solely doing doula work alone. So just to go over some of our high level findings, we'll have more formal reports coming out. We also have a webinar coming up soon. Skye, I don't know if you can put that link in the chat. But one of the questions we asked were, are your clients exposed to any negative climate change impacts? And as we can see, a large amount answered yes to this. We also asked about climate change concerns they had in the area that the workers worked in, and we see a large amount hot weather, flooding, wildfires, and then we also have some reports of extreme weather events, air quality, drought, homelessness, displacement, and access to fresh foods. Another question we asked was, do you feel like the families you serve are being supported to prepare for climate change impacts on their health and economic well-being? A great majority said no, and the following was to an extent. Do you provide any information about emergency response, government assistance, or other support that you could help pregnant people deal with hurricanes, heat waves, or other climate crisis related impacts? And as we can see, about half is yes or yes, but I want to do more. And then 35% is no, I don't know about these services. So we see an opportunity here to provide resources if wanted and needed. And then we also see that doulas are already doing this work as well. Do you provide any guidance or information about pregnancy health harms for extreme heat, hurricanes, flooding, or other extreme weather to your clients? And as we can see, folks are already doing this work. And then we also see 34% want to know how to do the work or want to know what providence or what guidance to provide. Would you like to get more training and information on environmental health threats to pregnancy and newborn health? Large majority said yes. And do you think it is important for doulas to have knowledge on environmental health, like pollution in the air and water, chemicals and products, and climate change, with 0 being not at all important and 10 being extremely important? Large majority believes it's extremely important for doulas to have this knowledge. And so with that, as I mentioned, that's not all the findings, but those were some of the key takeaways. And so we see that the respondents are worried about the climate crisis and they're seeing negative impacts. They do not think that individuals are being fully supported or prepared through resources. And they think that doulas can play an important role in really addressing environmental injustices and protecting pregnant people from the climate crisis. And they want more training and resources. So we're hoping to take all of this information, hopefully do it on a more wider scale. We know the EPA has a lot of funding, so hopefully we're already trying to advocate to get some of that money to RJ groups and birth workers. We're trying to really bridge that gap. We're going to continue to advocate for doula compensation and advocacy on the federal level, such as the Mama Bus. We'll continue to push this work from what we've learned. And I want to take the time to thank you all. I'm sorry again that I have to hop off, but I do have my email listed here along with our new social media handle and our new website. If you have any questions, please let me know. Feel free to reach out, or I'll touch base with the coordinators of this call. Thank you.
Thank you so much, C. Rafia, over to you.
Thank you, Savannah. I hope you can see my screen.
We can, yes. It's not in presentation mode, but we can see it.
Okay.
There we go. All set.
Okay. Thank you so much. The good thing about being the last presenter is that I can take my time. Okay, so I'm actually here to present the work that my organization, Forum for Safe Motherhood, has been doing in collaboration with Skye at Human Rights Watch and White Women Alliance, WRA. Now, this is basically a research work, a qualitative analysis, actually, to identify the intersecting extreme heat and maternal health crisis in the province of Sindh in Pakistan. Now, before I start telling you about the work, I first want to start with why and how we actually started working in this area. And for this, actually, I have to step, so to speak, back in time, something by around 2018-19. This is the year when White Women Alliance carried out a global advocacy campaign called What Women Want. Now, for those of you who don't know about it, this campaign actually was carried out in around across the world, and we reached out to around 1.2 million women under this. The idea was to go to women and ask them about their key asks regarding their reproductive health. In Pakistan alone, we reached out to around 250,000 women, and we asked them about their key asks. Now, initially, when the responses started coming, they were quite predictable. Like women were asking for, obviously more qualified doctors, or, better facilities, or, free medicines, things like that. But then, there were some responses which did not make any sense to us initially. Like, for instance, when women started asking us about things like, solar panels and uninterrupted supply of electricity and more access to clean drinking water. So initially, we were quite confused, but then when we did a deeper dive, we realized that most of these responses were coming from women who were actually based in those areas which were experiencing extreme heat. Most of them were coming from the province of Sindh. I actually always say this, I think at every forum, that these women may not know the climate change terminology, but they are living the climate change reality. And that's what they were trying to tell us in their own words. So we were like, okay, we need to explore this issue a bit more to find out what exactly women want. Now, we started with what we actually know. Now, Skye has actually elaborated this, so I won't be taking a lot of time. There's a lot of research available. You can easily access it online, which links, a pregnancy health and fetal development with extreme heat, and how there is an association between extreme heat and increased heat exposure with preterm birth and stillbirth and, hypertensive disorders and all that. Now, we found all this research, but what we could not find was women's experiences. I mean, what are they thinking? What are they feeling? What challenges is heat actually creating for them? How is it, in a way, altering their experience of pregnancy or of breastfeeding? And then what are they doing? What are the strategies which they are adopting to cope with this challenge? And more than that, how can we help them? What can we do to build their resilience, to make their lives a little bit simpler? So this was actually the basis which led to our research. So, as all researchers go, we developed obviously a methodology which always starts with some literature review of looking at what's available. And as I mentioned, while there's a lot of research in the whole phenomena, there's not much available regarding women's experiences. So we developed a framework and obviously some tools. There are always these rounds of ethical approval. I'm sure you're aware of that. We basically went to women it was a qualitative study, so it was an in-depth study. So we went to 16 women, 8 pregnant and 8 lactating, and we focused on Sindh, and the area that we focused on was the district Shikarpur, which experiences quite extreme heat, especially longer durations of heat waves, and this has been going on for the last like a decade or so. We also went to some healthcare providers and some government officials, and obviously then there's data analysis and report. Now, I'll now be sharing the findings of this study with you. And as I move forward, I will not be sharing with you any facts or figures, but rather I'll be bringing forward the experience of women in their own words. So I'll be starting with, first of all, about what they said in terms of their exposure to extreme heat and how it was impacting them. First of all, one thing that we noticed repeatedly in our interviews, in our discussions with them, was how heat was affecting them in terms of, causing dehydration, headaches, fatigue, lethargy, nausea, vomiting. Almost every woman we spoke to ultimately highlighted these things, feeling these things during the heat waves. So this was like the overall situation that was very recurrent. Then another thing which came forward, how heat was creating challenges in the sense it was, if a woman already had any kind of predisposition, if she was facing any kind of issues, for instance, the woman whose a quote I've mentioned here had hepatitis C, but if there's anything else as well, heat was actually compounding that. It was adding to it, making her life more difficult, adding to the challenges. That was there. Then there's a burden of care, in I think it is almost everywhere, but obviously I'm going to talk from the point of view of Pakistan. Ultimately, women end up being responsible for the family. Now, when there is a heat wave or when there are extreme heat episodes, obviously other people in the family do get, unwell as well. Heat strokes are common, diarrhea is common. So the burden of care also increases for women. And imagine all this happening while you are pregnant, or when you just become a mother and you just have a newborn baby and you're taking care of that as well. Then the economic consequences for the poor families. Basically, in Pakistan, 60% of the population is associated with agriculture directly or indirectly. So when there is heat, there is obviously less water, less rainfall, there's drought-like conditions. I remember we spoke to a woman, and she took us to this small patch of land right next to her house. This is where she did her own subsistence farming. And it was completely dry. And she pointed to it and she looked at us and she said, "What do I feed now? And how do I feed my children?" And how do you answer questions like that? Then building on that, you see, no matter how hot it is, you don't kind of get a day off. Women work, and even if they're in rural areas, they work. So what is happening right now is we are asking them to make a choice between life and livelihood. So either you work in extreme heat and you get a heat stroke, or you don't work, you stay at home and you go hungry. So this is the choice that we are coming down to now. Now, women do a lot of unpaid labor. We all know that. I mean, of course, household chores are there and it's difficult. In most of the houses in rural areas, the stove, the cooking area is actually outside in the open. So obviously they're not really sheltered over there. So as one woman said that the best way to avoid all this would be to stop cooking, but obviously they can't do that. Then, as I mentioned, they're always involved in subsistence farming. There's always they're taking care of livestock because livestock is always at home. And when it's at home, it's the women who are taking care of it. Then there is the collection and transportation of water. You see, in certain areas, women have to go and collect water. Now, obviously, it's hot. The woman is drinking more water, so is everybody else in her family. She's taking frequent baths, so is everyone else in the family. So obviously, the intake of water increases. That means the trips for getting water increase. Even besides that, even if supposing that there is a hand pump in some houses, that hand pump is actually always located in a place where there's no shelter. So even if you're pumping water, you're kind of standing under the burning heat, and doing that. Then, of course, childcare. Once again, a woman's responsibility through and through, no matter where she is. Now that, she's taking care of so many things already, and the childcare is there in all that heat. Now, women noticed, and women reported this, that, at times they end up taking out all the frustration that they are facing on their children. They end up hitting their children at times. I mean, they obviously said they felt sorry after that, but you know, the damage is done. I mean, I'm sure they must be feeling regret. And then look at the children. I mean, being hit by their mother for no reason whatsoever. I mean, imagine the effect on their, psyche. So, keep those factors in mind and think about all the different ways in which heat is compounding the different problems. Now, the pregnancy experience, generally, the best time in a woman's life, something to look forward to. But because of this heat, a lot of women said that they wish they had not gotten pregnant at that time, during summers. They could change their pregnancy once because it was like a really difficult time for them. And then during that, because of the heat, they also felt worry about their fetal development because they felt that the movement of the fetus had reduced. And that was, causing a lot of anxiety to them. Breastfeeding, actually, Pakistan, unfortunately, is one of the country where breastfeeding is not really very prevalent. Now, add to that the challenges caused by heat. You see, when it's extremely hot, you generally end up like, your sleep is really disturbed, especially in areas where there are long power outages. So when you have been up all night, like women said that they were breastfeeding and they kind of like fell asleep while they were feeding. Then also during like extreme summers, like you must have noticed that you don't feel hungry. Now the same thing happens with these women. Now, if they are not eating, then obviously this is having a direct effect on their children. The nutritional needs are not being met. So this again, once again, the whole cycle. Then this is an area that you were not expecting, the maternal health, like mental health consequences. The thing is that what we found in all these women was a general feeling of unhappiness. Obviously, like, you can attribute it to the poor sleep, they're stressed about their whole economic conditions. The heat in itself is like, very problematic. And they are worried about their children, the one which they're carrying, and the other older children as well, who are obviously, like getting ill in that heat, and they have to take care of them. And then one more thing, knowing that things will get worse. Women that we talked to, a lot of them said that, yes, it was hot last year, but this year it's even worse. Or they kind of like they were able to relate at how heat is getting worse over a period of time. So, and knowing that things will keep on getting worse and not seeing any chances of things improving. So in this status quo, we basically asked them, okay, what do you do? Like, what are you coping? Like, how are you coping? What are you doing? So first of all, frequent bathing in cold water. How frequent? 5 to 7 times in a day. I mean, hard to imagine. Then, since most of the areas, most of the rural areas have very long power outages, sometimes like 12 to 14 hours in a day. So, but they have electric fans whenever there has electricity. Otherwise, they have solar panels. Now, let me explain one thing. An entire solar panel system, that's very expensive. I mean, like, not many people can afford that. So what they do is that they have a very basic solar panel system, which does not have batteries, so they can't really save energy. That means solar panels work only during the day. At night time, there is no electricity. So then they go back to, these handheld straw fans. So either you sleep or you just, use this fan for yourself or your children. They sleep in open courtyards. And another thing, they distract themselves. Now, how do they do that? They do that by getting themselves busy in household chores, by going to their neighbors, by gossiping. I mean, I completely understand that. And then they also go to some places where they feel, which will be cooler. Like generally it's local schools after the school is over and they spend time there. A lot of women also told us that they'd like to be alone, like just the me time, just sitting there and just, like trying to, understand the challenges that they're facing and trying to cope with that. So, basically we asked them, like, what do you think we should do? What are the what do you think? How can we help you? So obviously the first thing that they said was like, please make sure that, we have a fan which runs for 24 hours a day. So, we need to have a steady supply of electricity. Then they were like, if that is not possible, then at least subsidize the purchase of solar panels and batteries so that at least we can afford it. And, we can have a fan at nighttime. They wanted information. Almost all the women said that, whenever heat waves come or whenever there's extreme heat, we always get these, these messages on their mobile phones or on televisions or on radios, but they're very generic messages. They don't tell us as to what should a pregnant woman do, or what should a woman do who has just had a baby. How should she handle heat? There's nothing specific about to us. So that was one of their concern. Then they said that, okay, in our, like the way things are, the men folk in our family, whenever there's heat, they have that liberty to go out and sit under the trees, or they all get together and go to a friend's shop and sit over there under a fan and gossip. Where do we go? So, we ultimately are stuck at home. Now, obviously, there are all these social and cultural taboos which further restrict their mobility. And then they identified a practice for us. I'm sure there are many, but they identified one practice for us, and that is the practice of chilla. Let me just give you a little bit of details about that. The idea of chilla basically is this, that obviously once a woman has had, a delivery, her body should stay warm. But generally, as traditions go, things kind of like get really extreme. So in chilla, what they do is they ask that a woman who has just had a baby should not take a bath with cold water for around 40 days. And during this time, she should just drink normal room temperature water. Now imagine that before this, it's so hot that she is taking 5 to 7 baths in a day just to keep herself cool and drinking cold water, obviously. And the moment she has a baby, no more baths, no more cold water, and you have to go. So, I mean, these traditions, this was the one was identified, but I'm sure there are many more which need to be looked into. Okay, so after all this, what are the recommendations that we have put forward as a result of all this? First thing that I think would be important would be preventing them from making that choice between life and livelihood. Whenever there is a heat wave, we can give some kind of cash transfers that would allow them to take time off from work. I believe something like this is being piloted in India at a very short scale, small scale, obviously, but that is something that we're looking at, and that is something which can be replicated, and we can learn from that. Then obviously we can look at investments into infrastructure, which can help them in cooling down. It could be planting trees for them, or using materials for their roofs, which kind of prevent heat to some extent or block it to some extent. Then, of course, very focused awareness campaigns, very focused information campaigns that tell them exactly what to do during pregnancy, during the 3 terms, and what to do when they just had a baby. And then, if possible, developing cool spaces. Well, they have found one themselves. They go to the local schools, but we can also look at clinics as well. And we can have some small associated places where they can kind of just come. We can ensure that there's electricity there, so that at least they can spend some time of the day, like that. So these are some basic things, but then there are some overarching high-level things that we're also looking at. I have obviously, we have obviously done this with the perspective of Pakistan, but maybe it will apply to other scenarios as well. In Pakistan, a lot of work is being done on this area, but it's very fragmented. It's very important right now for us to do a scoping study to really understand how the different actors, the development partners, even the government, even some academia, what are they exactly doing in this particular area, and kind of just bring all that work together and see where we can have synergies and where we can collaborate. So that is one thing. Secondly, this link between extreme heat and maternal and newborn health. This is not really embedded in the thinking of our decision makers, whether it is in the health sector or it's in the climate change sector. So this has to be connected. This connection has to be made, and we can go for typical things like trainings and meetings and workshops and dissemination of such similar research studies to make that connection. In Pakistan, we have lady health workers, which are the community workers. They are the frontline workers, and they're the ones who are interacting with community women on a daily basis. So we can use this medium to provide these women with the kind of information they require. And then finally, and this is the last point, but this is the most important point, it is extremely essential that in the country, at the national level and at the sub-national level, all climate change policies, adaptation plans that are being made, they have this component of maternal and newborn health very well incorporated in this. I'll give you an example. In Pakistan, we have a climate change policy, a national climate change policy, a very good document. It has a whole chapter on health. There is no mention of maternal health. Once again, we were working in Sindh. Sindh has just last year finalized its Sindh climate change policy. Once again, an entire chapter on health, no mention of maternal health. And like, you don't have to read the entire document, just do Control F and type the word maternal or reproductive or newborn, and you won't find anything like that. Mothers and children are mentioned, but as vulnerable groups in general, with reference to maybe nutrition, but no such connection exists. So this is important. I'm not saying this that people are like, they don't care. It's just that, as I mentioned earlier, it's not really on the radar of the concerned decision makers. And that's where this research has to focus. And that's what we plan on doing with it. So that's it from my side. Thank you.
Thank you so much, Rafia and Skye and Z, who had to drop. We have a few minutes, so if anyone has any questions, please either raise your hand or add to the chat. While we're waiting for that, would love to hear, Skye, a little bit how the care dynamic has come into this and how you've seen that kind of taking shape a little bit.
Yeah, the first point is what Rafia said about a lot of care work being hot work. So whether that's subsistence agriculture to feed the family, a lot cooking over hot fires, but then also care workers like doulas and other community health workers really being at the place where the rubber meets the road in terms of seeing the harms on pregnant people much sooner than others, but also potentially being exactly the workers we need in the climate crisis that can connect pregnant people to a wide variety of services, not only clinical services, but also like electric subsidies, improvements for houses, like sealing windows in wildfire smoke-prone areas, for example. And then the last thing I think is something that's harder to talk about, but I think maybe the most important thing, and I haven't really yet learned how to articulate it, but I often find when I'm talking to care workers like doulas and community midwives that they already have a philosophy and a vision of sustainability of human health and well-being that I think is a very powerful vision for a future that I think as we enter an increasing turbulent time, we need that visioning to pull us forward, as well as the kind of technical and concrete interventions. I spoke to one midwife who was called in by a doctor because she could put her kit in a car. She drove through wildfires to reach a birthing woman in California who couldn't reach a hospital. And, you know, she, but also many doulas I talked to have been dealing with crisis, whether domestic violence, housing problems. They are crisis managers already. They've already been in training for decades, and they may be the climate workers we need, but as Z mentioned, they're horribly under-resourced. And the same is true of lady health workers in Pakistan. I understand from talking to Rafia, she can say more, but they're an amazing asset, but they're under-resourced. And yeah.
Great, thanks for sharing that. Any additional questions? I see one. Could we keep an eye on, advocate for as we start to head towards our 2024 elections? That's a great point, Jenny, in terms of the US-based findings. And we will plan to share this recording and the link to the RH Impact webinar on those findings with you all after the call. So we're at time. Just want to say thank you so much to Skye and Rafia and Z for taking the time today. This has been really interesting, profound, heartbreaking, and I hope fuels everyone to get involved in this work. We would love to stay in touch and continue to hear from you on kind of the progress and the impacts that are taking shape. And want to say that we're hopeful that this is the first of possibly a series of, you know, learning sessions that GHB could host, kind of bringing in experts in this space to talk about important, timely, and emerging issues. So stay tuned for more. And thank you again to Skye, Rafia, and Z. We so appreciate you. Everyone have a wonderful day.